with prostate cancer have lots of different issues that come up over the course of their disease, and that's because the disease goes on for years and years and years often. And to address all those different complications and problems that they may experience, it can be important to have what we call a multidisciplinary team available. And a multidisciplinary team means that there are doctors with different subspecialties who all specialize in prostate cancer but approach it from different ways. And all of those doctors work together on an individual patient to really make sure that every need he has is met to the best of their ability and knowledge. So for example, at Vanderbilt we have a multidisciplinary team which includes a urologist and me, a medical oncologist, and within the next few months we'll be adding a radiation oncologist. Those three key core members are typically who's included in a multidisciplinary team, because the urologist can do things like surgery or implant stents or address urinary issues that men may develop. Medical oncologists are really expert in chemotherapy or pills and even hormonal therapies that can treat the prostate cancer. And radiation oncologists are vitally important for treating pain in particular sites, a particular bone metastasis in the leg or in the rib, and they can give short courses of radiation to really reduce pain and improve quality of life. In addition to these three key members of a multidisciplinary team, we like to include certainly nurse practitioners, nurses. We like to include people who specialize in nutrition and physical activity, and oftentimes our nurses can help contribute in that area, but we have specialized nutritionists who work with patients with cancer, advanced cancer in particular, to help make sure that they're optimizing what they take in to make sure that they're getting the best out of that they can. In addition, social workers are a key member or are key members of the multidisciplinary team. Often they can help with financial barriers that come up, and these are a big problem sometimes with the medications that we use for advanced prostate cancer, particularly the ones that we get from a pharmacy that are pills, because co-pays can be significant. They can help with that kind of financial counseling sometimes. They also help with just counseling in general and therapy, just talking to patients to try to help figure out what some of the stressors may be, and they can help address those stressors in whatever way may be necessary. Specialty pharmacists are critical when we're using medications that are oral and have huge copays. These copays can be $1,000, $2,000, up to $4,000 or more dollars per month, and no one can afford that. So in order to get patients the drugs that they need, specialty pharmacies really work with copay assistant programs and other relief organizations, even Zero, which is really important. We partner with them to try to make sure that patients can afford the exorbitant amounts of money that they have to pay to get these medicines that they truly need and will benefit from. Multidisciplinary teams can also include folks that are really focused on palliative care, pain and symptom management, and these people can be a critical addition to the overall comprehensive care of men with prostate cancer. We have been more recently incorporating our palliative care team early on in the process of treatment of men with advanced prostate cancer, and this is really important. I think something that's happening across the country as we really try to help men manage their long-term goals and plans. And what I think is most fascinating is that there have been studies that show that early involvement of palliative care actually makes people live longer. So anything we can do to make people live longer is a focus of ours, and I think many practices across the country. So these palliative care groups can be incorporated and can be helpful in both short-term and long-term goals, and are really a key piece of that multidisciplinary management team.